Hello, everybody. Thank you for joining us for our webinar today as we continue the webinar series we've been doing these past long 14 months or so. Today, we'll be covering another in our series of tools for back to school, and we're talking about COVID vaccine tracking. My name is Kelly Sinicola. I'm the Executive Vice President here at Fraley over professional services in a variety of areas. Hello to those of you that I know. Nice to meet you to those I haven't met before. Just as a couple reminders, please ask questions in the chat window. You can do that over the course of the entire presentation. We've got folks standing by to read through those. If we don't answer your question directly during the presentation, we do have time at the end to answer all the questions from the chat window. You have come in muted. Please keep your microphone muted during the presentation. And feel free to take notes as the presentation continues. However, just know that we will send you a link to the recording following the webinar for reference. So you can take notes, but you will have everybody's words for reference after the presentation as well, and that'll get sent out early next week. Today with me, we have two wonderful consultants from the Fraley team. We have Ann Miller, who's a senior consultant here at Fraley. We also have Lisa Hoppy, a consultant here at Fraley. Both of these ladies have done fabulous things for our clients. I know each of them both carry their own fan following. So make sure that if you have any questions at the end, they always have great answers. So you are in wonderful hands with them. So we wanted to start today with an overview. First of all, what are some of the requirements being proposed to return to school in the fall? And then what are some of the tools being used to track these requirements? As I mentioned in the beginning, this is a continuation of a webinar series that we've done, so you can see earlier recordings on our website. This is the third in this series. So common requirements that we're seeing so far as folks look to return to campus or have returned to campus are things like wearing a mask, requiring testing, quarantining, of course, social distancing, and we've seen all sorts of creative classroom layouts in order to enforce social distancing and lots of different classroom orientations. Also, new requirements that we're starting to see as vaccines become more available to the general population, are schools requiring proof of vaccinations. And this comes in a variety of different forms, whether it's for faculty, for staff, for commuter students, or for residential students. And different campuses are choosing to require vaccinations for different groups of the population based on what they've decided and how their campus is structured. So what we wanted to start with today was first a poll regarding how are you going back to school this fall? That will pop up in front of you. Your options are hybrid teaching and learning options to support both campus-based and online education, flexible academic calendar to support campus-based education that adapts to changing pandemic-related circumstances, returning to in-person education for all or most courses, or online education for all or most courses. And of course, this is a topic that we've seen that's been quite popular across many news outlets, and even amongst our own clients, there's lots of different options available. So I'm going to give everyone a few seconds to respond to that poll. Okay. So we see that the most popular option is returning to in-person education for all or most courses, followed by a hybrid teaching and learning option to support both campus-based and online education. And I would say that's what we're seeing a lot in the campuses that we support as well. Now we are seeing a lot of different news stories in the press as reopening requirements are changing definitely by the day. So Ann, Lisa, and I were even working last night because things are still changing day to day as we approach the fall semester. Popular things are vaccination requirements and COVID-19 testing requirements if vaccines are not being required. EDUCAUSE recently did a survey. This was just last month. And it was one of their quick poll surveys. It was held over April 20th and 21st and then released on April 23rd, I believe. And that showed that four-year institutions are more likely to require proof of vaccinations. And you can see a graph highlighting whether or not students, staff, faculty, visitors, and others would be required to have a vaccination in order to attend campus. And what EDUCAUSE found in this survey was that institutions are leveraging existing EHR or EMR systems that they already have on campus to store that data. And of course, when you get the recording, you will have access to these links as well. In the Chronicle for Higher Education, as of last night, 209 campuses are reported as requiring vaccinations. They do have a table that's nice and searchable. It does not require a subscription so that you can see the current status of campuses across the country and what they are requiring. So this is on the Chronicle. And again, when you get the recording, you don't have to worry about jotting down that long URL. But you're able to search by institution type, by the state, and whether or not they're requiring employees to be vaccinated, if it's a requirement for all students, or if it's a requirement for only residential students. And those numbers just continue to pile up, and we're currently up to 209 campuses requiring vaccinations. We're also seeing this from the colleges themselves. So Rutgers University is one of the first campuses to require all students to be vaccinated before arriving on campus in the fall. Colorado State University requires vaccinations for fall 2021. Washington State University is also requiring vaccines for students and employees for fall 2021. The president of Washington State University saw it as their duty to make sure that these vaccines are required for the campus populace. We've also seen emerging guidance from the organizations that we trust here at campuses across the country. NACUBO has coronavirus guidance for colleges that they've published. ACHA has interim guidance for COVID-19 vaccinations and just guidelines on how to make those requirements. And the CDC is also offering considerations for institutions of higher education. And so we come to our second poll, which will pop up in front of you. What technologies are you using to support the return to campus? Now, this is a carryover from a poll that we had last August in one of our sessions. And are you using health screening this fall, surveys about student readiness to return to campus, contact tracing, workplace safety management, surveys about faculty and staff readiness, exposure tracking, or physical distance monitoring and location tracking? So if we think about last summer into last fall, we were looking at all sorts of different options for how we could enforce, especially physical distancing. There's all sorts of apps. There are issues about privacy concerns. So as we enter this fall season, what type of technology are you using on campus? I'll give everyone a few seconds to respond to that poll. Okay. So we're seeing that health screening is the #1 technology that's being used. Surveys about student readiness to return to campus and surveys about faculty and staff readiness are also being implemented. And I do have something in chat that some folks are using many of those options, and I agree. It's definitely a more than one option. Okay, I'm going to turn it over to Lisa, and Lisa's going to talk about using Colleague, system you already may have on campus to track vaccinations.
Hi, everyone. Yeah, I will be talking about using Colleague to track vaccination information. So first, you can use the person health information form, the PHIN form, to enter and maintain health information about a person. Something to note is that the information maintained on PHIN is separate from the information maintained on the employment health information form, which is EHIN. That's part of HR. However, if you detail into the emergency information field, on either of the forms, it goes to the EMER emergency information form in CORE. So on the next screen, we can see the immunization fields on PHIN are stored on the person.health table, and the EHIN fields are on the person.health.HR table. So those are kept on a separate form. I'm sorry, different table. Computed columns would probably be needed to use those fields from person health to create registration restrictions. But you could also utilize PERC, the PERC screen, person restrictions, to restrict registration. It's also possible, since these values are kept in Colleague itself, that you could use a reporting tool to write reports to find information regarding students or personnel that have these immunizations completed. Any codes for tracking COVID-19 vaccinations on PHIN would be added to the immunizations core VALCO table. And that gives you that flexibility to enter whatever vaccinations you want to track. So if you're just trying to track, are they vaccinated or not, you can add something to this immunizations field. Or if you're trying to track what type of vaccine and which dose they have received, you could also track that. For maintaining vaccinations on EHIN, you would need to update the HR.immunizations, HR VALCO table, to enter any values you would need for that. And so we'll pass this on to Anne regarding the security and how to lock down those fields.
Hello, everybody. I'm so glad that you could take some time to join us today. So as Lisa said, it's kind of important to keep this, privacy is a big concern, especially when you're tracking medical information. So you want to be sure to secure it so not everybody can see this information. Colleague users can use the SCDF screen to restrict access to the immunization fields in both CORE and the HR applications. So you can either create a new security class to secure these fields or add these fields to an existing security class that is given to people who are responsible for entering and maintaining this information. The fields that store the immunization information in Colleague on the PHIN screen are phl.immunization, phl.immune.date, and phl.immune.exp.date, and these are the ones in the CORE application. So you would create this security class in CORE, and it is recommended that you set the security level to privileged access, because that eliminates the need for you to define levels for the majority of the users, to define a denial level for the majority of users that should not access or see this information. So if you create a new security class, then you will need to assign that security class to the people who are in charge of entering and maintaining the information. And then if you have HR and are maintaining that information for your employees, you would need to repeat this in the HR application for a security class. And those fields are phh.immunization, phh.immune.date, and phh.immune.exp.date. And those are the fields that appear on the EHIN screen. So for anyone who is not given the security class with the field level security access, their PHIN and or EHIN screen will look like this. The entire field is black for all records, whether this person has data in that field or not. So it's not just blacking out the immune stuff. So that way people can't actually, they can't guess that there's something entered there. So Banner also has fields that can be used to track vaccinations. For the Banner clients, a health waiver can be placed on SOA hold until the vaccine status is collected, and registration rules can be placed to read holds to prevent registration if you wanted to do that. And GOAMEDI can be used to track vaccine data. And Banner clients can apply field level security for this data with a fine-grained access control. This can be configured to allow HR staff to view or update employee records, but not the student data, and vice versa. So contact info@farilli.com for more information on securing these fields. And with that, I'll turn it back to Kelly.
Actually, it's coming back to me.
Oh, I'm sorry.
That's okay. Next we're going to discuss using tools that you may already have on campus to create forms for tracking vaccinations. So many campuses use O365 or Google, and you can make forms for capturing vaccination information using these tools. The Microsoft Power Platform allows users to create and deploy tailored applications that can be used for desktop and mobile devices. Microsoft released an app template for this crisis communication that you can use as a starting point if you are trying to do a do-it-yourself approach for this type of development. The solution for this crisis communication app was created within 48 hours after a team was formed at Microsoft to help customers during the COVID-19 crisis. This solution combines Microsoft Power Apps, Power Automate, Teams, and SharePoint into one cohesive solution. Employees can report their work status and make requests, and administrators can use the app to push news updates and specific content to their organization as mobile app notifications. And you can also add RSS feeds from reputable sources such as the CDC directly into the Power Platform application. The link is included in the slide deck here, and you'll receive this slide deck after this webinar. So if you want to investigate this type of no-code tool, you can follow the link to get more information. And this does let you leverage many pieces of the Microsoft technology in one single spot. If you're looking for something simpler, there's also a Microsoft Forms option. These come as Forms and Pro Forms, and these have slightly different feature sets from each other. You can automate the processes using Power Automate, which was previously known as Flow. There's been a name change recently, so now it's known as Power Automate. With Microsoft Forms, you can create surveys and quizzes that are fillable online rather simply and quickly, and you can invite others to respond to the forms and see real-time results as they are submitted. The Power Automate, it allows you to build workflow automation directly into your apps with a no-code approach. And this is important because it makes it very easy to maintain, and everyone likes that. It connects to hundreds of popular apps and services, allowing you to leverage the full Microsoft platform. And on the left, you can see a screenshot of a questionnaire that Kelly created for internal purposes. And she created this in about an hour through an easy drag and drop WYSIWYG interface. So it's pretty easy to create these. To create a form, you log into Microsoft.com, and the Microsoft 365 icons will appear on the left side of your screen. The forms will be an option, and you create the form, name it, and add an optional subtitle. So we always recommend that you add a good description in the subtitle so people know what your goal is and the purpose of the form. You can add a question through the WYSIWYG drag and drop interface, and there are various question types to choose from, such as choice, text, rating, and date. And in an extra drop-down menu, you are given options for ranking, Linkert, file upload, and net promoter score. And Microsoft Forms also offers branching opportunities, so you can build logic directly into the form. So that's good, so that you can, with having this no code option, you can still use logic in the form. To automate the form, you log into office.com and icons appear on the left side, and Power Automate is one of your options. When you create a Power Automate flow, you can create one from the number of templates provided, or you can choose to create an automated flow, an instant flow, a scheduled flow, a UI flow, or a business process flow. In this case, we're showing here the scheduled flow was selected, so the form would be sent out to a group of users at the same time every day. The results from the form are collected and stored, and reports can be written from this data. Now pass this back on over.
All right, thanks, Lisa. So for those of you who use Google on your campus, Google Forms is another option. It is also a tool to build fillable forms and surveys, just like Microsoft. And the data is then stored in the background within Google Sheets for reference. The form data can be stored anonymously, or you could encode it with the user's username. And you could also request that data within the form. In the example, that link goes to a COVID-19 self-assessment screener form that Google has created. It walks you through a series of questions based on the CDC database, and then gives you a recommendation for what kind of medical care you might need for COVID-19. So in this case, according to the screen on the right, it looks like I'm feeling okay based on the responses I provided, and and having no evidence of symptoms. So to use Google Forms, you log into your Google account, select Forms from the Google Apps selector, and then select the plus to create a new blank form, just like in Microsoft. Then you have options to add questions to the form. So this is a WYSIWYG, what you see is what you get interface that allows drag and drop. So it's really easy to use and easy to update. So then you have options for the types of questions that you want on the form, which are short answer, paragraph, multiple choice, check boxes, drop down, file upload, linear scale, multiple choice grid, checkbox grid, date, and time. So Google also has a number of plugins that have been developed over the years. So it's very extensible, and you can use that on your campus. So these are a few of the other companies that have made significant contributions towards helping businesses manage a safe return to a new normal. Many of you have RAVE for your emergency response system, and you might have Medicat as your medical records provider and other service providers listed here. Hashtag Campus Clear is a free resource that's available to schools to try. And this is, a good opportunity for you to look into the vendors that you currently use to see if there's anything that they offer that you can leverage in order to reduce your effort and time to get a solution out to your campus. And back to Kelly.
Thank you, Anne and Lisa. I do want to comment that privacy data is, of course, always a concern on campuses. So if you're looking at using things like Google, things like Microsoft, you have to make sure that you work closely with your IT departments to make sure that that data is kept and secured. Many campuses already have to track vaccine information because of tracking things like MMR vaccinations. So also important, don't look at this as just another new thing that you have to implement, but look at current best practices on campus, what has been working, what hasn't been working, to see what you can use just to get this information out as quickly as possible. And if your campus is still deciding on what the new normal looks like, as Anne mentioned, then at least there's other campuses to look to see what they're doing. As always, we're a community here in higher education, so we have to hold each other up and lean on each other to get through all the new hurdles that this pandemic has had to offer. As we've mentioned, we have been doing this webinar series for a while. If you go to our What's New page, you'll see our upcoming webinars as well as all of our previously recorded webinars as well. At this time, if anybody wants to ask any questions, I know one came up in chat but was answered on the next slide. But if anybody has any questions, you can either choose to utilize the chat box or come off mute.
I noticed a question come in about advice on reporting securely. This client uses Intrinsic Informer, and there is a way within Informer to put security on the on specific fields. So that is something that we would be able to help you with if you have a need for more information.
Yep, Jason, absolutely possible to do field level security in Informer. I know we've done it so many times with SSN and birth date, but this is also data that would need to be secured in that way. And another question, any thoughts on pulling data to either Microsoft Forms or Google Forms? What kind of options for autofill? Is it a good option for an approval workflow? There's ways of pulling data into Google and Microsoft. Of course, security is never secondary here at Frelly, so we always want to be concerned about the privacy of the data and who can see it and who cannot see it. Microsoft has done some really exciting things recently, especially around something called School Data Sync that allows you to pull information out of your ERP, your SIS system, to use then in the Microsoft Power Platform. You can also use it to do classroom teams, all that type of stuff. So definitely ways of getting to that data. And then especially in things like SharePoint lists, you could use that to autofill any Microsoft form options. So that would be an option there for autofill. And we do internally here use Microsoft Forms for internal processes. It's great for approvals. There's also older frameworks within SharePoint that you can use for workflow processes as well. So a couple options there that could sort of be workshopped. And see one of Anne's fan club. Anne does rock, I agree. Has Frelly had any experience answering questions about HIPAA compliance with SIS and Office 365 or Google? We like to refer any questions about HIPAA to whoever's responsible for your compliance department, just to make sure. But we can absolutely help you with how, based on your guidance from your compliance folks, how we can set that up in the tools that you have on campus. We've gotten really good at super granular security on the O365 front. We've had folks in our security cloud and infrastructure team that can do granular security very, very well, better than I can even explain. So we know the tools well enough where we can implement any security standards that are required by your compliance department. questions, concerns? Okay, great. Well, thank you everybody for attending our webinar. If you have any questions about what we covered today, questions about implementing any of these processes, we are always available for a phone call, and our opinions are many. So feel free to reach out to info@frelly.com or directly to your account manager if you have any questions, wondering about how to set something up, if you want to workshop some ideas. That's what we're here for. Thank you, everybody, and have a wonderful day.